All right, this is video 8. We're starting out right in the app, and we're going to take a look at just 3 muscles in video 8. It makes it seem so simple, doesn't it? So here we go. We're looking at Pectoralis Major. There's Pectoralis Major. A little bit of a complex muscle. It's a big muscle, and there are a number of parts to it, but that's Pectoralis Major. So we have attachments along the clavicle, attachments along the scapula, and attachments along the ribs, and then all of those fibers are going to go across the shoulder, more or less anteriorly, slightly under the shoulder joint though. So like this on the app, you can see the shoulder joint, and you can see where Pectoralis Major crosses the joint, that it's just below the joint itself, but it crosses on the anterior side of it. Okay, and then it attaches to the proximal humerus, and specifically where it attaches is the lateral lip of the bicipital groove. So we've seen a couple of muscles attached to the medial lip of the bicipital groove. That was latissimus dorsi and teres major, and now here is Pectoralis Major attaching to the lateral lip of the bicipital groove. All right, let's look at our next muscle that we're going to look at today. It is here, Pectoralis Minor. So Pectoralis Minor is deep to Pectoralis Major, and let's see, but different in so many ways. The word pectoralis refers to chest, and so of course Pectoralis Major means it's a big chest muscle, and Pectoralis Minor means that it's a small chest muscle. So they're in the same area. That's why they have similar, both the name pectoralis, but they function-wise they're really pretty different. So Pectoralis Minor attaches to the coracoid process of the scapula, if you can see that there, and it attaches to ribs 3, 4, and 5. Okay, so we're going to see some interesting movements there. So those 2 muscles, and our third one is a tiny little one right here called subclavius, and we're not going to talk that much about it really. It's a little muscle that goes from the clavicle to rib 1. Let's see if we can see it from above. Not really. We kind of have to look from below to see it. So see it going from the clavicle to rib 1. Let's just talk about its actions just real briefly here while we're looking at it. Basically, so attaching to the clavicle and attaching to rib 1, you kind of go, well, what movement can it do? It can pull down on the clavicle, right? So it can depress the clavicle, or it can lift up on rib 1. So we're going to see, this is our first muscle that would be considered an accessory breathing muscle. And when we look at Pectoralis Minor, we'll see that function also. Oops, holy cow, now we're getting into other muscles that we don't need to talk about. So subclavius can elevate rib 1, and so we have a number of muscles that attach to the rib cage and function as accessory breathing muscles by moving the ribs and helping either to expand the rib cage or compress the rib cage to help with inhalation or exhalation. So subclavius, honestly, the only thing I want you to know is just kind of have a sense of the name and the location, but you don't have to know specific attachments, and you don't really have to memorize specific actions, because you can tell. There it is. It must pull down on the clavicle or pull up on rib 1. That's the only thing it could do. So that's subclavius. So let's go ahead and put Pectoralis Major back on here, and then, oh come on, there we go, and then we'll step out of the app and we'll take a look at actions of these muscles. All right, actions of Pectoralis Major. So Pectoralis Major is our big chest muscle here. So it attaches on the medial half of the clavicle, but as long as you know it's the clavicle, that's fine, but it's the medial half of the clavicle. And then it attaches down the sternum and the costal cartilages of ribs 1 through 7. So what does that mean? That means that it doesn't just attach to the sternum down along midline, it also attaches lateral to the sternum. So where the ribs and the sternum articulate, there's some cartilage there, and so this muscle attaches to that cartilage. And so essentially what that means is that it attaches to ribs 1 through 7. It just doesn't attach to the bony aspect, it attaches to the cartilage, which is the part that's closer to the sternum. So all the way down, so it's a pretty big muscle, and we can divide the muscle into separate sets of fibers. So we have clavicular fibers, are the fibers that attach to the clavicle, and then we have the fibers that are called sternocostal fibers, which are the ones that are attaching to the sternum and the costal cartilage. So the whole muscle then, so it's attaching all through here in the chest, and then the muscle crosses the shoulder joint more or less anteriorly, like, okay, not more or less, absolutely on the anterior side of the shoulder. The shoulder itself is just superior to where pectoralis major crosses here. And so there are some fibers actually that cross a little bit superiorly and some fibers that cross a little bit inferiorly. And so we're going to see a wide range of actions again. So let's look at actions of pectoralis major. First action is adduction of the arm at the glenohumeral joint. So remember what that looks like? Adduction, like that. And so this is one of those actions. Why do we have a big, strong muscle that does something that gravity does for us just fine? Is really because we're going to use pectoralis major. Like if we're swimming or if we're, pulling on something and moving our body, it's that same action of adduction, but the body's moving rather than just moving the arm. That's where we'll use a strong muscle like pectoralis major. So a lot of body support kind of stuff, if you're doing body weight exercises and moving your body, there will be usually a lot of pectoralis major involvement, like push-ups or handstand push-ups even, and like in the other video we looked at bench press and some other movements where we're doing, movements. Oh, sorry, I tapped the mic. Where we're using pectoralis major. All right, let's look at other actions. Immediately rotates the arm like this, right? So it crosses this way, fibers are going like this. If these fibers shorten and they pull on that lateral lip of the bicipital groove, comes around like that. All right, medial rotation. It flexes the arm at the glenohumeral joint and it extends the arm at the glenohumeral joint. Okay, so here we go, opposite actions. So it's more the clavicular fibers here, when they contract, it can do flexion of the arm at the glenohumeral joint or shoulder flexion, just like anterior fibers of deltoid, right? And they're right next door to anterior fibers of deltoid, right? Here's anterior fibers of deltoid, and here's the clavicular fibers of pectoralis major. So they're next door neighbors. It totally makes sense that they're going to share an action. So they are synergists in this action of shoulder flexion. But then these sternocostal fibers, especially the ones that are down low, they can shorten and pull the arm back down to do extension. So pectoralis major does both flexion of the shoulder at the glenohumeral joint, or flexion of the shoulder flexion, and extension also. So both directions. It can move it because it has fibers that go like this and fibers that go like this. So these fibers can do flexion, these fibers can do extension. All right, and what other actions? Abduction of the arm at the glenohumeral joint. So our first action we looked at was adduction, this, which makes sense, right? So if we're going to pull this attachment at the proximal humerus, which again, remember, is the lateral lip of the bicipital groove, if we're going to pull that closer to these attachments, boom, adduction happens. Well, how can we make abduction happen also? Well, that's where we're going to get back into these clavicular fibers. So think of these clavicular fibers almost like fibers of deltoid in a way. So remember that deltoid had those 3 sets of fibers, and when all 3 sets of fibers of deltoid worked together, we had abduction happening. So think of the clavicular fibers of pectoralis major kind of like anterior fibers of deltoid, and that it can do the same actions as those. And so abduction is one of those actions. So with these upper fibers, we can pull up and do abduction, and then these fibers down here are going to pull down to do adduction. Very similar to, we can do flexion and we can do extension. It's just in a different plane, but we have a very similar thing happening there. Let's see, this muscle can also do horizontal adduction or horizontal flexion. Okay, so that's starting here and moving here. And so, so pectoralis major can do a lot of like putting the arm into this position. So depending on, even if we're like in an oblique plane, you know, it doesn't have to be straight up abduction or straight up flexion. It can be kind of in between there. Pectoralis major is going to be able to do that. Similarly, it's going to move the torso, you know, when the arm is in positions like that. Okay, let's see. Is that it for pectoralis major? All we need to talk about there? It does also move the scapula some, and it does that by, you know, well, various ways, but it can move the humerus around. It does medial rotation, and it can do that enough that it pulls that into the scapula into protraction. But I'm just asking you to know the first 6 actions in the book for pectoralis major. So that's adduction of the arm at the glenohumeral joint, which looks like this. Medial rotation of the arm at the glenohumeral joint, which looks like this. Flexion of the arm at the glenohumeral joint. Extension of the arm at the glenohumeral joint. Abduction of the arm at the glenohumeral joint. And horizontal adduction or horizontal flexion. Okay, those are the actions of pectoralis major. Let's look at pectoralis minor. Now, pectoralis minor, remember that guy really much smaller than pectoralis major. There's 3 little sections of it. And so attachments of pectoralis minor, dog barking, are ribs 3 through 5. Okay, so ribs 3, 4, and 5 it attaches to right in through there. And then the coracoid process of the scapula. So it kind of sits right kind of like that. So this is a muscle that definitely moves at both ends. You know, we don't just have one end moving and the other end not moving. Let's look at the standard mover actions of pectoralis minor. So we have protraction of the scapula. So that looks like this, bringing the scapula forward. Pectoralis minor attaching to the glenoid, attaching to the coracoid process, it's kind of going to bring the scapula forward and down a bit. So people with chronically rounded shoulders will tend to have chronically shortened pectoralis minors, and that is important. It's ideal to have open shoulders and not have shortened pectoralis minors, and we'll talk about that in a second here. Let's look at the other actions. So protraction of the scapula, so bringing the scapula forward, that's one thing that pectoralis minor does. It depresses the scapula, so it can bring the scapula down. So again, here's Brady, he's helping. It's attached to that coracoid process and attached to the ribs, so when that shortens, it's going to bring the scapula down. And then it downwardly rotates the scapula. So for downward rotation of the scapula to happen, here's that scapula. It has already done upward rotation, and for downward rotation to happen, it's going to come like this. And so these fibers here that are attaching to the coracoid process are going to shorten and pull this, you know, help to rotate the scapula in downward rotation. So its reverse mover actions are interesting actions. So this is where we get into pectoralis minor as an accessory breathing muscle. So pectoralis minor attaches to ribs 3, 4, and 5. And so if we're doing deep breathing, well, let's say first, if we're doing normal quiet breathing, the only muscle that's moving is the diaphragm. And we'll talk about the diaphragm in a few weeks. But if we're doing especially deep breathing, then we're really moving the rib cage a lot when we breathe. And so this is where accessory breathing muscles come in. And pectoralis minor is one of those. So to take a deep breath and really expand the rib cage, we want to lift up on the rib cage. And pectoralis minor can lift up on ribs 3, 4, and 5 and help us really take a very full breath. So it's an accessory breathing muscle, and it elevates ribs 3, 4, and 5. Now, some interesting bits about pectoralis minor. It's a pretty simple, pretty straightforward muscle. It's difficult to palpate. Pectoralis major is not difficult to palpate because it's the most superficial muscle of the chest. So you should be able to palpate those fibers and, you know, feel where they are on someone. When palpating pectoralis major, do be aware of breast tissue in women, and you can usually just sort of deflect breast tissue out of the way and, you know, and get to pectoralis major and be able to palpate it. Pectoralis major makes that anterior fold of the anterior axillary fold. Remember that latissimus dorsi made the posterior axillary fold. Okay, so pectoralis major, pretty easy to palpate. Pectoralis minor, pretty difficult to palpate because it is situated deep to a big muscle, deep to pectoralis major. So to get there, you actually have to go under pectoralis major. This is something that massage therapists learn to do, and you can get in there, but it's not easy to get in there. And if you don't need to, you know, I would leave that to the professionals, to the massage therapists, and let them get in there and work pectoralis major. Anyway. But the importance of pectoralis major, why would you need to release that muscle? Well, number one, it's chronically shortened in a lot of people. Why? Because a lot of people have shoulders that are rounded forward from desk jobs or sitting at the computer or playing video games and that kind of thing. Shoulders are slumped forward. Energetically, what does that do? It closes off the heart, and you know, it feels like a sort of a separation and a protective sort of a posturing. Very, very common. But what happens with that is pectoralis minor can become chronically shortened, and it has a bundle, a neurovascular bundle that goes underneath it. So this neurovascular bundle comes out from the neck, goes under the clavicle, goes under pectoralis minor, and then heads out to the arm. And so when that bundle gets pinched or compressed, it can create problems down the arm. So it can create a decrease of blood flow down the arm, it can create numbness and tingling down the arm, and it can create sensations like carpal tunnel syndrome, even if there is no compression in the wrist. All the compression is up here. So we call that thoracic outlet syndrome. And thoracic outlet syndrome can happen for many reasons. One is a chronically shortened and or tight or inflamed pectoralis minor. So let's see. What else do we need to know about that? I think I wanted to tell you, that's basically it. So, but I wanted you to know that about thoracic outlet syndrome. So thoracic outlet syndrome, we'll look at other muscles too that can put some pressure on those nerves and on the blood vessels in that area. But pectoralis minor is a significant one that can do that. You know, the other thing about pectoralis minor actually, so we talked about posturing and rounded shoulders and that sort of thing, creating the shortened pectoralis minor. Also, people who are doing a lot of forced inhalation, so this could be people who are smoking or vaping. This could be people who have chronic lung diseases where they're struggling to inhale. And they're using a lot of their accessory breathing muscles to try to get deeper breaths. Pectoralis minor can become overworked and, you know, not so much chronically shortened, but inflamed and tired and overworked, and that can put pressure also on that neurovascular bundle. Okay, in our last muscle, subclavius, basically I want you to be able to identify subclavius on a diagram. You saw where it was on the app, and you know, it's a short muscle. Basically, it's giving credit with depressing the scapula, the clavicle, but also it can elevate rib 1. So it can work as a breathing muscle, but it's a minor muscle and it's not one that we need to worry about too much, but I wanted to kind of include that in the chest muscles. But the main muscles, the big main mover of the chest is pectoralis major. Pectoralis minor is an important muscle too, you know, mostly because it can become chronically tight and give rise to lots of problems because of that. Okay, so hey, what do you know? For once, a short video. So that's pectoralis major, pectoralis minor, and subclavius, 3 muscles of the chest. And the next video, we're going to look at some muscles of the upper arm, and that will wrap up our shoulder section. And so we should have a whole sense then of all of the muscles that can do all of the actions of the shoulder and moving the scapula as well. All right, so let's see, our word for this video is, I'm thinking of it right now, it's gnats, because I have gnats flying in my eyes while I'm trying to make this video. Okay, so last video, what was it? Rotator cuff. This video, gnats. G-N-A-T-S, gnats. All right, see you in video 9.